There are 115,000 people in the U.S. needing a transplant. 20 people die every day waiting for one. More organ donors are needed. As News Channel 5's Matthew Torres shows us, Tennessee patients are getting help from an unlikely source, the opioid crisis.
I'm actually 42.
A birthday is a celebration of life.
My birthday was Monday.
Even when life itself is tough.
There were days where I was tired.
Patrick Fry was diagnosed with a congestive heart failure. His condition got so bad that he needed a heart transplant.
I packed up 4 o'clock this morning.
Since his surgery 2 weeks ago, the 42-year-old is doing better as he celebrates a gift that saved his life.
I feel so much more revived. Now my birthdays go backwards, so I'm 41 all over again.
He still doesn't know who his new heart came from, just that the donor had hepatitis C. It's a growing trend that's proving to make a big difference.
We have a number of donors who are victims of or have suffered a narcotic overdose.
Dr. Ashish Shah says many of them have hepatitis C. With the growing opioid epidemic, more people are living with the infection. The rise in opioid-related deaths in the state is also boosting the number of available organs.
A recent study shows there were 3,500 transplants using overdose-related donated organs in 2016. In 2000, that number was just 149.
Shah says the donors are typically younger than 35 years old with healthy organs. Despite hepatitis C and past drug abuse, advanced medicine makes the organs fine to use.
Is there something about their heart that when you take it out of that body, put it on ice for 3 hours, sew them into another human being, will they not work as well as someone who didn't use drugs? And it turns out, no, they work great.
I feel great.
Fry understands that someone else's tragedy was his saving grace.
I feel like I was blessed with his heart for a reason. So I was given a second chance.
He now wants to meet the people whose family member unknowingly gave him another reason to celebrate life.
You're gonna make me cry.
In Nashville, Matthew Torres, News Channel 5.
Shaw says about 10% of all donors in Tennessee had a drug overdose. Tennessee Donor Services encourages you to register as a donor. 38% of Tennesseans are registered, well below the national average of 54%.
New information tonight in the hepatitis outbreak here in Nashville. The number of cases in the city is up to 83 now. This is since December of last year. The Metro Public Health Department released the updated totals today. And make sure you don't fall victim. The health department is still offering the vaccine to at-risk populations. If you'd like more information about that, we have it posted on newschannel5.com.